My name is Maritza, and I'll be doing a knee X-ray, and it consists of 5 views. And I'll be starting with my AP knee X-ray, and I'll be getting my patient. Hello.
Hello.
Okay, can you tell me your full name?
Lottie Hudson,
Okay, your date of birth.
6/16/89.
Okay, and any chance of pregnancy?
No.
Okay, and then what brings you in today?
I've had knee pain
Okay, and how long has that been going on?
about 2 weeks.
Okay, and is it the right knee?
Yes, it's my right knee.
Okay, so I'm gonna have you lay down here with your legs facing that way.
Okay.
Put the shield on you. Okay, so I have my tube detented already. I'm gonna raise the tube. So my SID is 40 inches here. And then, so it's already detented. I have a tube angle of 5 degrees because, so tube angulation depends on the distance of the asses to the table, and for her it's greater than 24 centimeters, so I will be having a 5-degree angle cephalic. Okay. So just make sure that her epicondyles are parallel to the IR here, and then the central ray is a ½ inch inferior to the apex of the patella. Okay, and then I'm going to add my marker. And just make sure I have an inch all around. Okay, and then I'm going to be using a technique of 80 kb at 8 mass, and that's going to go for 3 of my views. Okay, so don't move. Okay, X-ray, and that's my AP. Next, we're going to be doing the medial oblique, and we're going to keep the tube angle. Okay, so we're just going to turn her leg 45 degrees internally. Move your hips for me. There you go. Okay, and then my central ray is ½ inch inferior to the apex of the patella. Which is about there. And then make sure we have an inch around. And then put my marker. Okay, and then same technique, 80 at 8 mass. Okay, okay, don't move. Okay, X-ray. Okay, next we're gonna be doing a lateral knee. Okay, so I'm gonna have you roll over to your affected side. So roll over towards me. And then I have you, bring your leg here, and then my tube angle stays, and the central ray is an inch distal to the medial epicondyle, and then I have her leg, leg flex 20 to 30 degrees here, her knee. Got my marker on there. Okay, so don't move. X-ray. Did it again. Okay, so next I will be doing the sunrise, and I'm going to be using the set of gas method. Okay, so I'm going to have her seated on the table like she is. I got a shield on her. So for this one, I'm going to have you flex your knees here, and then I'm going to have you hold the plate here. Okay. Right. So I'm going to have my central ray perpendicular to the patellofemoral joint, and then I'm going to have a tube angle between 15 to 20 degrees. It depends on the degree of knee flexion. So I have my marker also on there, and so I'm going gonna go ahead and take my x-ray, and I'll be using a technique of 70 at 2 mass. Okay, so don't move. X-ray. Okay. Okay, so next I will be doing the tunnel, and I'm gonna be doing the Camp Coventry method. So I have my patient prone. So I placed the IR under her right knee here, and then next I'm gonna flex her knee about 40 to 50 degrees. Okay, and then I'm going to my central ray is going to enter at the long axis of the leg, and then it's going to enter at the popliteal fossa. Okay. And then so I'm going to have my marker. Okay, and then I'm going to shield my patient. Okay, and then I'm going to be using a technique of 70 at 6 mass. And okay, so don't move. Okay, x-ray. And we're done. So now we're going to check if our images meet the criteria. We're going to start with our AP knee. So we have our patella here, our femur, our lateral condyle, our intercondylar eminence, the head of the fibula, and then the tibia. So we're checking to make sure that there is no rotation, and you can tell by the femoral condyles are symmetric. Slight superimposition of the fibular head and the tibia. Patella is superimposed over the femur, and then there's an open femorotibial joint space. Now we're going to assess our AP oblique knee with medial rotation. So again, this is our patella, our femur, our lateral condyle, our tibial plateau, our fibula, and tibia. So in order to have a good image, we have to see that the tibia and fibula are separated, and that the patella is projected on the medial side of the femoral condyle. Now we're going to assess our lateral knee. Again, this is our femur, our femoral condyles, our patella, our tibial plateau, the tibia, and fibula. So we're checking to see that the knee is flexed 20 to 30 degrees, and that the femoral condyles are superimposed, and then that we have an open patellofemoral joint space. Our next image, we're going to assess the intercondylar fossa. So we have our patella, our intercondylar fossa, our lateral femoral condyle, the tibia and fibula. And so we're just looking to see that there is an open intercondylar fossa space, and that there's no rotation demonstrated by the superimposition of the tibiofibular overlap here. And then we're checking that the apex of the patella is not superimposed over the fossa. Next, we're going to be assessing the tangential projection of the patella, also known as the sunrise. So we're just checking to see that we have our patella, our patellofemoral joint, and then our lateral condyle, and then our fibula. So we're just checking to see that the patella is in profile, and that we have an open patellofemoral joint space. And